do you treat submandibular gland tumors? I'm Dr. Babak Larian from Center for Advanced Parotid and Facial Nerve Surgery. Well, when you look at the parotid gland here, you can see the tumor growing in there. By the same token, in the submandibular gland, which is this one here, just deep to the jawbone, you can also have tumors developing, let me show it, and growing, as you see here in the parotid gland. Now, fortunately, there are no nerves that travel right through the gland itself. But if we were to look at the cross-sectional anatomy here, so if you do a cross-section here, remembering that this is the jawbone, this here is the gland. Let me draw it for you. So you have the skin of your face coming into your neck and down. The jawbone would be here with the tooth in it, right? And the submandibular gland, which we'll draw in red, is partially behind the jawbone. Now, the gland has a covering on it, and the neck has a muscle layer. We'll draw in green. There's this muscle layer under the skin that allows you to do this to your neck, right? It's called the platysma. The nerve, the lower branch of the facial nerve that comes and goes to your lower lip, moves your lip down, that branch is between the green layer and the blue layer. So if you have a tumor in your submandibular gland that you need to remove, if you approach it by making an incision in the lower neck, below the level where the nerve to the lower lip is, right? The incision is lower. You come from underneath and you go into this blue layer and you dissect in this blue layer, then you can take the submandibular gland along with the tumor in a safe way and keep the nerve to your lip protected. There's also a nerve that goes to your tongue that's deep to here as well. But again, it's outside of that blue capsule that covers the submandibular gland. So yes, tumors in the submandibular gland occur. They are a minority of tumors of salivary glands. Majority happen in the parotid gland. But when they do occur, you have to have some experience to know how to protect the nerves that are just outside of the gland, right? The nerves that go to your tongue and that are in charge of your feeling and movement of the tongue, and the nerves that go to your lower lip that are superficial to the gland. And once you know the anatomy well and you do this well, you can take out the gland and the tumor safely without really causing much of a problem. During these surgeries, I also put nerve monitors in the muscles of the lower lip, so when I get close to the nerve to the lower lip, they give me alerts. So extra measures of safety to try to protect against any kind of side effect or complications that can arise. And these surgeries are a lot simpler than the surgeries done in the parotid gland because there's a lot more nerves in the parotid gland that are going right through the gland itself. So these can be much simpler surgeries. Usually patients have this surgery if we don't have to remove the lymph nodes in the neck. This is an outpatient procedure without needing a drain, and they can go home and pretty much eat right away. So the tumors can be relatively more easily treated in the submandibular gland. If you're interested in clear salivary gland information, visit us at parotidmd.com. Be well.